Kidney stones are one of the painful diseases of the urinary tract, for which there are various methods of treatment, and you should see a kidney and urinary tract doctor. But the pain is severe and acute when the stone blocks the ureter or kidney. Other symptoms such as nausea and vomiting and sometimes pain from the right side of the abdomen appear, which are confused with appendicitis infection. If you have a history of kidney pain or urinary problems, blood in the urine indicates kidney stones, foamy or foul-smelling urine. The pungent smell of urine is the smell of ammonia. This smell indicates a urinary tract infection or kidney stones. Decrease or increase in the volume of urine. The more the stone moves to the lower part of the urinary system, the more intense the feeling of urinating, and it may occur with symptoms such as burning pain when urinating. Fever and chills, flu-like symptoms and fever and chills appear. The size of the stone is the main factor in determining the duration of its removal. Stones smaller than 4 mm are removed by themselves in 80% of cases, which takes 31 days to remove, but stones that are 4 to 6 mm long require medication to remove them, and 60% of them is excreted spontaneously in an average period of 45 days, and 20% of stones higher than 6 mm are excreted naturally. Men are twice as likely to suffer from kidney stones than women, and of course genetics plays an important role for both genders, and family medical history is more likely to develop kidney stones. If the stone is not removed completely, after some time it will block the flow of urine to some extent or cause infection and bleeding. Stone-crushing treatment methods include medication, surgery, depending on the size and type of stones. These treatments may involve ureteroscopy, extra-organ stone crushing, and double J surgery. Another method is nephrolithotomy, which is performed through the skin and requires general anesthesia. After a stone-crushing operation, it's quite normal for your urine to be bloody for up to 3 days. During this time, you should drink more fluids. You should also urinate in a container or net for a few days after the operation to collect any expelled stones. Moreover, it's important to take the prescribed medicines according to the instructions and keep yourself hydrated with plenty of fluids such as juice and pale tea. On the day of the stone-crushing operation, you should rest. However, you can continue your daily activities and even engage in exercise the following days. Activities like walking, hiking, and jumping rope will facilitate the passage of stones, especially if accompanied by drinking plenty of fluids. In case of fever, chills, and severe pain that does not improve with prescribed painkillers, severe dizziness, stoppage of urine flow, excessive blood in the urine for more than 3 days, or any other unusual symptoms, go to your doctor or to the emergency room of the hospital. To prevent kidney stones, it is better to drink enough fluids. Doctors recommend drinking at least 3 liters of water a day. Reduce the amount of salt in your diet. Do not eat snacks such as chips and pretzels, pizza, lasagna, factory sauces, cakes and cookies, processed cheese, stewed foods. The consumption of calcium in the diet is emphasized, such as kefir yogurt milk, which should be consumed 3 to 4 times a day with calcium-rich foods and calcium drinks. Eat low oxalate foods. For example, spinach, rhubarb, and almonds are rich in oxalates and should not be consumed. I hope you are all alive and well.